So welcome everybody to the March Knowledge Exchange Cafe. For those of you who are joining us for the first time today, I-Cords is a community of practice that centers around the social and behavioral sciences in the field of neglected tropical diseases. Its purpose is to bring people in this field together to learn and collaborate with each other. And one way we do this is through our knowledge cafes, which help us hear from experts in the field and to hold a discussion on the concepts that are shared and learned. The session today will highlight the process of establishing and managing Kikundi, which is also a community of practice for NTD Program Managers. Kikundi aims to center the expertise, ideas, and leadership of NTD Program Managers in the global fight against NTDs. This session will explore the successes, challenges, lessons learned, and future prospects of the community from the point of view of the program managers themselves. Today, our moderator for this session is Dr. Pendo Muingaira. She is a leading expert in the control and elimination of NTDs. She is currently the technical director for RTI International on the U.S. Agency for International Development Act to End NTDs East Program, which is a global flagship initiative to help endemic countries fight NTDs. Dr. Muingaira has a 19-year career in public health, which includes research and program leadership focused on NTDs. Before joining RTI in 2019, she was the program manager for Tanzania for 10 years. So thank you to Dr. Muingaira for taking the time to moderate our session today. And so the first speaker I will introduce to you is Wycliffe Omundi. He is the head division of vector-borne and neglected tropical diseases, tasked with the responsibility of steering the control and elimination of both endemic vector-borne and neglected tropical diseases in Kenya. And thank you to Wycliffe for joining us today. And our remaining speaker is Tudu. She is the National NTD Program Manager of Botswana and the current chair of the Kikundi Leadership Council. She holds a medical degree from the University of Ghana Medical School and an EAD TMH from the London School of Tropical Medicine and Hygiene. And thank you to Tudu for taking the time to join us today. And so now I'll pass the stage over to our speakers and we can get the session going. Whenever you're ready, Wycliffe and Tudu.
Good afternoon. Rachel, do you want us to project or you're going to project from your end?
Yeah, so Wycliffe has got the slides up, so that's perfect so that you can control it on your end.
All right. Good afternoon, everyone. As I've already been introduced, Dudu Mulifi and the current chair for Kikundi. And the format of this presentation, next slide, please, will be some presentations covering the background and objectives of Kikundi, as well as the leadership structure by myself. And Wycliffe will then do the rest of the presentation, which is based on the Kikundi's 1-year impact, and then our priorities as Kikundi for 2023. Then we'll then take questions and answers. Thank you. Next slide. So Kikundi was formed in 2021, and actually in 2020. And this was following a meeting in 2019 where 12 African NTD managers met at the ASTMH annual meeting. And they met to brainstorm solutions around challenges that are common to all of us as African program managers. And they generated the statement, the problem statement that's there that says, NTD program managers experience knowledge and research gaps, resource gaps. And how to prioritize, make decisions, manage critical stakeholders, and collaborate with sectors outside of NTDs and effectively execute programs. So these were, or these are challenges that we face as NTD program managers. And the potential solutions discussed highlighted the need to strengthen the community of program managers. And this included peer learning, mentorship programs, capacity building opportunities that are there, as well as forums that are only for program managers. Next slide, please. Next slide. So to talk about the objectives of Kikundi, our main goal is to develop a strong and digitally supported community of African NTD program managers. And this is done by providing a platform through which we participate or we learn from one another and collaborate in pursuit of reaching national and global NTD benchmarks. Our aims is to increase the skills, knowledge, and confidence of NTD program managers in Africa for evidence-based decision-making as well as leadership, to strengthen the long-term capacity to meet NTD program manager needs through technical, scientific, and administrative support. Next slide. I just want to add that most of us as NTD program managers in Africa are not just looking at NTD. So some of the skills and capacity building that occurs within Kikundi actually doesn't just go beyond NTD programming, but other programs as well. For example, I'm in the TB program. So I benefit a lot from Kikundi Platform. What I learn here, I'm also able to apply to the TB program. The development process, Kikundi was developed using a collaborative process, incorporating inputs from program managers across the continent. And it took a co-design approach where there was constant feedback and input from PMs to help to create a platform that was responsive to their needs. So Kikundi is a Kiswahili word, which means group, and the Adinkra sign that you see there was adopted from Ghana. It signifies unity and community. Next slide, please. So this is just to show, that we want to be a united community and work together as a group to be able to reach our goals. So Kikundi has a leadership structure, and the program leadership has two sets of advisors. Or we have the advisory committee, which is made up of external advisors from various communities, all being NTD experts in their own rights. And then we have the leadership council, which is made up of program managers who are members of Kikundi. And these program managers are the governance structure for Kikundi. The program managers who form the leadership council usually serve for a period of 1 year, and they're elected from within the community. Currently, we have 10 members, including a chair and a co-chair. And we meet on a quarterly basis to make decisions about the direction of Kikundi and the future of Kikundi. The council is also supported, like I said, by external advisors who form the advisory committee. So they give support to the community and foster critical partnerships and links. So as and when we have issues or technical advice that we need within the leadership council or within the community of practice, these are our go-to people. It currently has 7 members from different institutions. ITI and ESPN are also represented here. And if anybody here would like to form or to be part of the advisory committee, you are more than welcome. You just need to reach out to us to be able to support us. The development team, there's a development team that helped put Kikundi together, and we get support from University of Washington, as well as the University of Global Health and Health Equity, which is based in Africa, in Rwanda. They provide program management and technical, as well as operational support. And work very closely, I must say, with the Leadership Council, as well as the Advisory Committee to move things forward in Kikundi. Next slide, please. As I've been saying that Kikundis for African Program Managers, so membership is limited to national NTD Program Managers, so you have to be a national NTD Program Manager. I know we have program managers who may be seconded by partners. Those are not eligible to be members of Kikundi. We would like this to be strictly national program managers so that we can have the voice of the governments, or if I may call it that. And we elect other program managers. So for example, if I'm the National NTD Program Manager and we have focal disease program managers, we are able to elect those focal disease program managers to be members of Kikundi. Next slide, please. So when you go on the platform, like I've been saying, platform. We have a platform. It's a digital platform where we interact. So on the platform, this is where the community of practice is hosted. We have our logo, we have various things that we're able to do. We share events. We have a direct messaging option where you can directly message one program manager to ask whatever questions you want to ask. We also have courses that are availed to us through the platform, and you can directly go to the courses and select a course that you would like to take when it's available. We have regular updates on the platform. And as and when we have new resources, this is where the resources would be placed. So as and when, say, ESPN has new strategic direction and we're taking up something new within the NTD community, it would be shared on the resources platform. We also have a forum for discussions. So this is where, if I have an issue, any program, and I want to share with program managers for their advice and just to discuss and get views and expert advice from other NTD program managers, this is where I would go to be able to get all the help that I need. It's a very active platform, I must say, and with lots of conversations going on at different times. Next slide, and I think it's over to you, Wycliffe.
Thank you so much, Chair, for highlighting the Kikundi structure, membership, and also how we operate. You will allow me to highlight some of the achievements that the group has managed within the past year. So since the launch more than 1 year ago, Kikundi has been working with a growing number of program managers across the continent in the fight for control and elimination of neglected tropical diseases. And The report that I'm going to share with you describes the progress over the past year and sheds more light on the experiences of the managers that form part of Kikundi. You're also able to find a copy of this report by visiting our website as it's been highlighted by the chair. We'll now address some of the key impact metrics for our first year. So an overview of what we've been able to achieve in the first year is as highlighted in this PowerPoint, in which we've been able to onboard 45 program managers. And as the chair highlighted, these managers, the team that has been onboarded are composed of both national program managers as well as those nominated by the program managers but serve within the Ministry of Health. Additionally, we've been able to share 87 resources related to neglected tropical diseases. These resources, if you navigate through the website, border around the master plan for specific countries, the guidelines, publications, PowerPoint presentation on various aspects of control and elimination, reports, resources, work plans, and also some of the websites of partners that we engage with. We've also conducted 127 country updates. These updates are consisting of new milestones showing where the countries are in terms of control and elimination, and also the successes based on the various interventions that we employ, such as mass drug administration, of course, around bordering some of the events like World NTD Day, surveys that we conduct. We've also been able to provide forum discussions, and these forum discussions border around ideas and questions that the program managers have. These questions are responded by fellow colleagues who may be having experience on the key topical issue that has been shared by fellow members. Now, currently, the membership stands at 57 program managers, and these 57 managers are spread across 29 countries. And these 29 countries stretches from Southern Africa, Eastern Africa, Central Africa, and Western Africa. And we are currently in the process of onboarding Democratic Republic of Congo. Now, in the first year, Kikundi has supported 39 different program managers to enroll in a free leadership project management courses. And these courses vary, that the team members are called upon to embark on. They include leadership in management in health, fundamentals of implementation science, policy development and advocacy for global health. We also have a course on project management, monitoring and evaluation in global health, introduction to epidemiology for global health, economic evaluation in global health, fundamentals of global health, that the program managers are able to enroll free. These courses are provided by University of Washington. Participation in these courses have had direct impact on how program managers manage their country programs, mainly thinking about partner engagement, resource mobilization, as indicated by the quote that you can see on the left, and additional updating of master plan. And I can just quote the one that from master plan, the method for monitoring and evaluation framework I learned is now being used to help develop the NTDs master plan. Now, the membership also engage in a number of collaborative learning activities, and these are organized annually and consists of in-person visits. The managers observe one another's programs, they brainstorm solutions to common challenges and establish best practices across the NTD program. Majority of these collaborative learning activities lasts for about 1 week, and they are hosted by the site's program managers and serve as opportunity for program managers to observe NTD programs across the continent. And this includes some of the novel approaches employed to fight NTDs. Our inaugural site visit was in Rwanda in 2021, where 10 program managers managed to participate in this activity, and the engagement revolved around participation in the National Rwanda Technical Working Group meeting that was held in Kigali. We also able to observe vector surveillance, to be specific, snail control for schistosomiasis in Butaro, in northern part of Rwanda. We also managed to observe morbidity management, disability prevention for podoconiosis in a health facility. And the members present were also able to participate in community and school-based mass drug administration campaigns. To cap it all, the program managers in the first inaugural site visit were taken through a one-day protocol development workshop to shape their skills in protocol development. The Rwanda visit was followed by a second visit that was conducted last month. This was held in Senegal. The second annual visit was attended by 14 program managers. And during this 5-day visit, the team members managed to conduct the following activities in Senegal. They participated in NTD program integration that was looking at integrating NTDs malaria, development of post-validation surveillance, and also participated in lymphedema, morbidity management, and disability prevention. The team members that visited Senegal also were able to participate in a multi-sectoral NTD master plan dissemination workshop. And lastly, they were also able to participate in supply chain strengthening management. Now, these site visits have had tremendous impact also on the program managers, as you can see from the information or feedback Selectly, we've provided two. I'll just read one because of time. Seeing a teacher giving drugs to children over 10 minutes really changed my view of the entire mass drug administration process. This is something I will try to convince my team back at home to adapt. The work ethic between community health workers and teachers was great to see. And this is coming from a backdrop that we operate from different countries and our MD exercises are not harmonized, where there are some countries where it's only exclusively a preserve of medical officers. But here, the program manager was able to see that the mass drug administration can also be undertaken by non-medical officers. Now, I want to take you through strategic partnerships that the group members have been able to engage in. One of them is engagement with the Bill Melinda Gates Foundation team to mobilize the program managers to share their feedback on critical gaps in control and elimination of NTDs in a research perspective. And this engagement have resulted into or shaped up a request for proposal. For example, the 2021 Bill Melinda Gates request for proposal incorporated the members' view that brought about innovation in elimination of neglected tropical diseases. This call was looking at about 6 key thematic areas. I believe it is still on the website. For those who are interested, you can have a look at it, though it's expired. We've also worked very closely with Uniting to Combat Neglected Tropical Diseases to discuss the 71st session of the World Health Organization Regional Committee for Africa. And the outcome was that it helped in designing the new grant opportunities, which reflected the views and priorities of the program managers. We also work very closely with the Expanded Special Project for Elimination of Neglected Tropical Diseases, ESPEN, on the joint application package. This is a package that is used for requisition, for reporting of interventions that we conduct at various country level. So this feedback is currently being disseminated based on the information that was provided by the program managers. Now, Kikundi platform or team, for us to achieve this, we have to measure ourselves where we are, and the community of practice maturity model is what we've adopted as a way to conduct longitudinal evaluation using a 4-stage parameter. And after 1 year of implementation, it is our firm belief that we've reached the second stage of the maturity model, and we are progressing towards sustaining this. And that second stage is emerging or evolving, as you can see in the presentation. Now, this is some of the impacts that the program managers have been able to achieve in the previous years. The main challenge that the previous managers faced have been relatively constant over time. And as you can see, they are bordering around resource scarcity, implementation of WASH activities, partner coordination, supply chain management, limited staffing, lack of proper implementation, monitoring and evaluation tools. To address this and other noted challenges, Kikundi has strived to improve the capacity of collaboration between African NTD program managers, notably the proportion of Kikundi members who said that they were either satisfied or very satisfied with their jobs increased from a baseline of 62% to 71% after 1 year. I would also want to take note that program managers identified skills that they wanted to build within the community of practice. These skills included developing research protocols, writing scientific papers, developing skills to improve communication with funders and partners. Now, during the first year, Kikundi identifies specific opportunity for program managers to build their targeted skills. For example, the Kikundi worked with 9 program managers to draft manuscripts as co-authors, 7 program managers to write grants, and 10 program managers to complete a protocol development workshop. Overall, you can see the skill sets. There was a decrease in leadership, need for leadership and management skills, decrease for designing prevalence surveys, decrease for writing scientific papers based on the strengthened perspective from the membership. Another key achievement was on some of the key activities that program managers provide directly to their team members back at home, from supervision to managing supplies. And overall, there was confidence in terms of supervision at baseline compared to endline that was conducted. Now, what are some of the next steps and priority areas that the Kikundi team is looking into? The first one is in program integration. And when we talk about integration, we're saying that the Kikundi established among the program manager community, and it is crucial that we integrate into the wider NTD community. To this, we are engaging with different partners and institutions, exploring avenues of partnership with the African Leaders Malaria Alliance, ALMA, a coalition of African Union of Heads of State for better integration with other ongoing health activities. We believe that a stronger integration will lead to increase in prioritization of neglected tropical diseases at all levels of government. Another key priority area in the year 2023 still continues to be in professional development and advocacy for neglected tropical diseases. And as program managers, we already have some multitude of skills that will bring to enhance the roles that we play. However, we are aiming to help build capacity in key areas of need, which keeps on being identified by various program managers, and some of them, just to highlight: budget management, to help plan and achieve targets and goals outlined in the country master plans. Kikundi will be building these opportunities in collaboration with partners and collaborators, ensuring that high quality, relevant information is available to all members. Another key areas is in domestic resource mobilization, and we all agree that domestic resource mobilization is a priority for all NTD program managers and partners. During discussions with the partners within the community of practice, many program managers have identified their interest in developing domestic resource mobilization and advocacy strategies. To this end, Kikundi is on a path to develop resources and tools to support program managers to advocate and mobilize for their own country programs. Another key priority areas is on program performance and priorities, which I can say that in order for us to build a strong business case for Kikundi, we need to ensure that developing a robust set of measurements, metrics, and approaches that align with the needs and priorities of program managers and other key NTD stakeholders. We are leveraging on the strong evaluation expertise of UGHE and University of Washington to innovate our program performance evaluation using a series of qual, quant, and mixed method approaches. Now, another key area that we are looking into is program sustainability, and many members have expressed interest in working with the community of interest, community of practice to create country program snapshots and priorities of documents that can be shared with partners and provide key updates on country progress towards priority areas. On sustainability, the Kikundi plans to shift to an all-African institution by the year 2024. In order to achieve this facilitation and manage transition of the community, the team is developing a sustainability plan. Already, some stakeholder identification and priority planning has been done, and with program managers looking forward to expanding the plan to ensure sustainability for the coming years. That caps our provision in terms of what is Kikundi, membership, the structure, and some of the key achievements we've been able to make in the last few years of existence. Thank you so much, and I'll hand it back to moderator, Dr. Upendo Mingira.
Thank you, Wycliffe and Tuju, for providing that presentation on Kikundi. It was really interesting to see where you started and some of the impacts that you've had on the communities and the program managers that you've been working with. So I'll pass it over to Upendo. I see that we have some comments already in the chat. So feel free to throw your question in the chat, or you can raise your hand and we'll work through some of your questions for about the last 20 minutes or so.
Thanks, Rachel. Thanks, the presenter, Tudu and Wycliffe. This is so exciting for me as a former program manager. I see a very good progress, and I would like to congratulate you all for the great efforts and good work done. Moving straight to the questions in the chat. I think we have two. There was one on the joint application package. I think, thanks, Alison, for responding to that question. I don't think we need to go more on that unless there's an additional question. There's one from Doris Jomo, who is asking, how come program managers attendance, especially for the Senegal learning trip, was low? About 50% were there. Is there any strategy of improving and maintaining a high attendance?
I'll attempt to take that one first, then the chair will also add in. I indicated that in the first meeting that we had in Rwanda, only 10 program managers participated, but the Senegal one, we saw a rise from 10 to 14. Nonetheless, as observed by Dr. Njomo, compared to the total number of program managers, is still a drop in the ocean. And I think the attendance borders around available resources for the number of program managers who can be supported by the available resources. So I'll turn it over to Tudu to add more on that.
Thank you, Wycliffe, and thank you, Doris, for the question. Like Wycliffe said, attendance of program managers to the site visits is really determined by the resources available. We've seen an improvement from 10 to 14. We would love to have all program managers present, but the funding available just wasn't enough to be able to do that. There is usually communication months prior to the site visit. I remember for this particular one, which was in February, communication came out as far back as October, and program managers are asked to apply because we know we don't have enough resources. So those who are interested then send in an application for their intention to attend the site visit. And it's always based on that, the number that applies and the availability of funding for PMs to attend. Thank you.
So maybe just to add on the strategies to improve on this, I just want to touch base that in the last leadership council meeting, we just proposed that in case that there are other implementing partners supporting countries that are able to support additional program managers outside what Kikundi has, that would probably improve the numbers in the next meeting. So probably that is a strategy moving forward. Over to you.
Okay, thank you. I think, Doris, you are satisfied with the response? Doris? Okay. Okay, then there is another question here I'm seeing from Gemma. Do you have any example of things you did or change in your country's NTD policies as direct results of Kikundi?
I'll attempt that. I think change of policy is something that it's a long process, you know, so we won't see changes in policy within a year or two, but I think in terms of how we practice, and I'll speak for myself, the things that I'm able to do now in my program from what I've learned in Kikundi has really taken me and my managerial skills forward. I'm able to now better manage the stuff that I have and the little resources that we have. So in terms of, also just in terms of resource mobilization and reaching out to the private sector and other partners that may not necessarily have been in the NTD space, we've been able to get more funding through that. You know, there's been advocacy skills that we talk about within the Kikundi group, and I've used some of those to be able to get things moving within the program.
So maybe just to add on some of the changes based on the site visits, I just shared on the In the presentation, one of the program managers highlighted the need to move from a centralized health worker mass drug administration campaign to a community-based one, which is more efficient. So probably that is one change that resulted from the site visit. Again, from the 2 site visits, we'd have a very good interaction in terms of morbidity management and disability prevention. And most countries are picking up on the examples that were witnessed both in Rwanda and Senegal to implement in countries where MMDP has never been done. Again, from the 2 country visits that we've done, we are seeing various kinds of advocacy and awareness creation that may not be unique to various countries. So again, countries are picking that. It may not be in terms of policy, but we are picking some of the best practices from the site visits to employ in our various countries once these site visits, we are through with them. Back to you, moderator.
Yeah, thank you, Wycliffe and Tudu, for your response. We have a question from Alison. Please, you can raise your hand as well, not necessarily put in the chat. You can also raise your hand and speak it up. We have one from Alison. This is ICOD, I think, you know, all of us, we are joining from this ICOD platform. So this is also a community of practice for social and behavioral research. So are there priority challenges that you can share with us, which needs additional research and attention from this group?
I think now as we move towards the end game for some of the diseases that we're looking at, for example, LF, one of the things that we may want to look at is factors that may be influencing the uptake of drugs during MDA, or issues that may be contributing to, for example, some countries or some communities are not able to reach their targets for MDA. So what could those be due to, and why we keep having resurgence of some of these diseases? Some of these issues could actually be behavioral. For example, in terms of schistosomiasis, we find that it's really hard to reach the elimination goals that have been set. So is this something to do with the communities themselves, or is it something that we are doing that's not benefiting the community? Should we be doing things differently as programs? You know, I think those are some of the issues that we may also need to look at as we move towards elimination and control of some of these diseases.
Thank you, Tudu. I think that's very important. I've noted as well in my previous capacity as a program manager, the diseases like, for example, trachoma, you find that they are very much now towards the end game, they are very much localized to a certain group of people, some indigenous or marginalized communities that need extra efforts. So I believe, yes, ICOD could be beneficial to some of these research work or kind of implementation or research activities. Thank you. Any addition? Is there any additional question, Alison, to that?
No, I appreciate that response, and I just wondered if Wycliffe had anything to add, but yeah, I thank you very much for that. I appreciate it. It's useful for us in ICORDs to make sure that we're responsive to the needs that are being felt and experienced in programs.
Thank you. Any other question? I have one. You shared in your presentation that in your platform, there is somewhere where people can, resources can be shared. I want to know now, wearing my cap as a partner, not a previous program manager, that how can a partner or an organization share some sort of resources to the Kikundi? How does that happen?
Because partners are not part of the Kikundi platform, I think you can share with us individually, and we can post on the platforms, or through University of Washington, the development team, we will share the Kikundi email address as well, so that if there's anything to share, you can just drop an email and all these things will be shared with us on the platform.
So maybe
Thank
just
you.
to add on that, I want to note that under the resources, we've got quite a number of thematic areas. And one of the areas is partners website. So I believe through the partners website, it can be linked to Kikundi, where such information that is valuable to program managers can be annexed and they can access it from there.
Okay, thank you. We appreciate that and I'll work on that. We have a hand, Rachel.
Yes, thank you. I noticed on your second last slide in your sustainability planning that you had to increase your international collaboration. Is that more so from the partners' perspective, or has there been a push to expand the ability for program managers to join if they're outside of Africa?
So I may look at it from two perspectives. One is collaboration, not just within the country, but between one country and another in terms of cross-border issues that have been really one of the challenges. One country may have made a lot of milestone while the other is not. So how do we ensure that we are at balance and not a risk factor to another country? So engagement with the AU that we are talking about is bordering that, but nonetheless, it's also internationally looking at how can we have additional information from other areas, not just looking within the continent. Maybe Tudu is having additional information.
I think we're also looking at partnerships in terms of just partnerships to support the platform or the community of practice, because like when we looked at the sustainability of the community of practice, we have very few partners that are supporting, and we do acknowledge that we need a lot of financial and technical support for this to continue. So it's also amongst the things that we're looking at. So any international partner that is willing to come on board, we are more than happy to have all the support that we can get.
Yes, that makes sense. I can echo that from the I-Corps perspective as well, that the partnerships are crucial in running a successful community of practice, and even providing opportunities such as these knowledge cafes where you're able to form those relationships and those partners with other organizations to support each other, so that we can all work together and meet our goals. Thank you.
Thank you, Rachel. Is there any other question from the participants here? All is clear now with Kikundi? Yeah, thank you for the response and your questions, those who could ask. And I think most of the things were very clear. I'll thank you all for having me to moderate you, but I'll get you back to Rachel now. Thank you.
So thank you to Pendo and Tudu and Wycliffe. We really appreciate the time that you've taken out of, I'm sure, your very, very, very busy days. So we really appreciate you speaking with us today. To those of you who are still with us, I'm going to just release a quick poll just so that you can provide us some feedback on the session. As well, I will put in the chat our next Knowledge Cafe, which will be in April. So this one, it will have a focus on mass drug administration. As well, if you are not currently an ICORDS member, I have included the link in the chat as well, and you're welcome to join. Anyone is allowed to join, and it's a free registration. And then you'll also be able to hear about our other events and opportunities. So I will end the recording here and release the poll. Thank you to everybody for joining us today.